Eric Odom, Executive Director of the American Liberty Alliance in Oregon, one of the organizers of the August 22nd recess rally, joins the conversation. Karen and Jonathan are still here. Eric, how do you get the most bang for your buck on this? In other words, how do you get the most productive use of the energy that you're able to generate without either being destructive or violent? In other words, how do you help us solve for the fact that we have the most inefficient health care plan in the world beyond screaming and yelling?
Well, I first, I do want to kind of address, you say the destructive and extremist. There are certainly destructive elements of this fight and extremism, and they're happening within the unions and the thugs of the left. And to be quite honest, it's interesting to see. Who knows?
Here's what I'll grant you. If you want to cast accusations, there are extremists on a variety of places that are exhibiting behavior that's counterproductive. I prefer that it's not directed one way or the other, quite honestly. But
sure. But let me just say that it's interesting. It's interesting to see that those who are the world's most professional community organizers are upset that we're organizing communities.
But no, you're changing the conversation. I'm going to, just for the moment that I'm hosting this show, just for as long as I host the show, I get to control the conversation. And my question is very simple: how do you use your power to be productive to reforming health care in America? You can tell me who's a jerk, who's an idiot, who's a bad. I don't care. How do you use the power that you have, which is clear and admirable, in organizing these people to help America go from spending 1/6 of its GDP on health care and coming in tied with Costa Rica? How do you help us be constructive?
Well, we do it the same way that our founding fathers did, and that's by helping people. You showed a clip earlier on that said, "You work for us, hear our voice." That's exactly what people want.
And what do you want heard other than
it's emotional?
Anger? But my point is very specific. What is it that you want heard other than "we're pissed off"?
Well, I think I think we're hearing that all across the country. People are saying we can't afford anything else. We can't afford more taxes that it's going to require. You're talking trillions of dollars. I'm a business owner. I'm feeling the pinch. Yeah. I'm feeling the pain. That's what we're saying. We can't afford to do anything like this right now. As a business or as a private citizen, you have to look at things and see if you can afford them. If you can't afford them, you can't purchase them.
Yeah, I completely agree with that. I totally agree with that, which is why I look at it. It's like, man, we're spending all this money on GDP, or this huge percentage of our GDP on healthcare, and yet the overall quality per person is terrible, right? On a relative basis. For some, it's good, but basically,
no, I don't think so.
No, it absolutely. It's just that's a mathematical fact. It may be fine for you, but the reality is whether it's Contessa's inability to lead to start. Let me finish. Let me finish, and I will let you finish, sir.
I would love to see some examples.
I'm going to give you some examples. I'm going to give you. You know what? If you just want to play stupid word games on cable television, please do it on another show. I would love to have a conversation with you that's productive.
I just think there are people all over the world right now who come to America to get health care. All over the world, in both the north of the border and south of the border. Our insurance is our health care is really good right now. I think it's disingenuous to say that we have bad health care.
So let's be clear how we're defining quality. I agree that we have the best quality available service. I just think that we're spending way too much because we have anti-competitive practices in the health insurance business. We have anti-competitive practice. Why are you in favor of and supporting anti-competitive health insurance practices? What do you think about Wyden Bennett, which would actually just create competition in the health insurance market? Have you entertained this idea?
I'm sorry, that didn't make much sense to me.
Wyden Bennett is
suggesting that by removing the free market system,
let me clarify myself so I can make sense to you. I would hate for my inability to communicate to hurt our conversation. Wyden Bennett is a piece of legislation that was proposed by 12 senators. There was an op-ed in the Washington Post earlier this week. It specifically says that the mathematics of insurance require a mandate to bring the price down, and they suggest a tax credit to allow portability so that employees can move with their health care inside of the private system, and it suggests a private marketplace on the internet where people can go and adjust and choose their health insurance plan, forcing real competition among the health insurers. What is the problem with that?
So in other words, you're suggesting that the same government who told us the stimulus package was going to provide millions of jobs, and who told us the stimulus package was going to solve the problems of the economy, is now going to solve the problems of the free market health care system.
No, what I'm saying is the government. No, that's not what I'm saying. I'd like to clarify myself. What I'm saying is the government right now is taking bribe money from the health insurance companies to support anti-competitive practices to ensure their excess profitability at the expense of the American health care system and our legislators have proposed a bill that is a capitalist bill that encourages competition for the health insurance companies to the benefit of the consumer, and it is beyond my comprehension how anyone who claims to be an American will be in support of a process that protects anti-competitive practices, whether it is in the banking system, the healthcare system, or in energy. So it has nothing to do with this government or any other government. It has to do with whether you are in favor of rules that encourage free market competition for the provision of services to people. Are you against competition to serve people, sir?
Well, of course not. I'm not against competition.
Then why would you be against Wyden Bennett, which is in favor of competition to serve people? You said the
government takes bribes. I agree the government takes bribes, and that's exactly why I don't want the government telling me what doctor I need to see or telling me what sort of medical plan I need to be on.
No, I agree with you. No, stop. This is brilliant. I totally agree with you. And Wyden Bennett does not do any of those things. Wyden Bennett lets you choose within a private health insurance plan. Wyden Bennett lets you leave your job and start your own small business as an entrepreneur and begin true capitalism. Wyden Bennett has nothing to do with government control of healthcare. I understand you may be fighting the public option, which has been proposed out of the Congress, but what I'm suggesting to you is there is a third option, sir, that is neither a public option nor a do-nothing option, but is a rational approach at health insurance reform to encourage more competition and more choice for more people in this country. And it does not make sense to me as a rational human being, not a political human being, why we would not, as a group of people, expect more competitive, more choices. Why wouldn't we want that?
Well, I don't think anyone's suggesting that we don't want that.
No, you are.
I'm certainly not suggesting that I don't want that. No, not at all. What's being protested right now is government-run insurance, not the legislation that you're referring to, if indeed that's what it says.
So why not change the conversation from this is stupid to this is better? How about using your rally to say this is better as opposed to saying you're stupid?
What people are upset about is not what you're talking about. What people are upset about is when people have a conversation, and congressmen and women have had this conversation all across the country, that they actually believe some sort of government-run, public-run alternative is a better solution.
Karen,
that's what these protests are addressing.
I understand, but what I'm saying to you is why do we have to play Hatfields and McCoys when there's a rational concept that just creates more competition, and then the people on the left and the right might be able to get together and say, hey, why don't we have more competitive health insurance, and then we'll have a conversation about where we go from there, because people in America in general deserve their government to try to work to make for more efficient systems where they have to be involved, like with things like health insurance or energy resources. Karen, go ahead.
Well, look, unlike the labor groups, which are inviting people to come to these town halls and actually ask their questions, one of the issues here on these right-wing groups is that, again, you have insurance companies or some of the folks backing these groups. And when we talk about government-run insurance, I mean, Dylan, I know you're all about the Wyden plan, and there may be some merits to it, but we've got to. We have 3 government-run plans right now: the veteran system,
expensive,
the Medicare system, and the very system that our members of Congress get. So if it's good enough for them, why isn't it good enough for the rest of us?
Karen, Wyden Bennett, Ron Wyden based Wyden Bennett on the congressional system.
Right.
It's
so why isn't
basically
that good enough for the rest of us? If it's good enough for them, why is and when we talk about when we talk about the VA system has higher customer satisfaction than any private system. So clearly the government's doing something right, but the point is
no, they're not. I disagree. Here's where I take issue with that, Karen. They're getting great results, but at what cost to the future of our nation? To which is, I think, Eric's point. And the reason I like Wyden Bennett is it costs less.
If we want to have a discussion about cost savings, sure. I mean, and that's part of what the president's plan is.
It's a huge part of it.
But again, what we're talking about here is if you like what you have, you can keep it. If you don't, let's come up with an alternative.
Understood.
And let's also acknowledge, and one of the things I think this gentleman is not acknowledging is, frankly, health insurance for the majority of people in this country is not so great.
Yeah.
47 million don't actually have it. And for people like you and me, we're actually paying for those people. So again, to this cost issue, we're paying for the people who don't have health insurance.
Which is why I like Wyden Bennett, because again, it makes Eric, I'm going to let you go. I got to say, I'm really pleased that you joined us for this conversation, and I mean that quite sincerely. I hope that you will rejoin us to continue this conversation. And my only point to you is I understand not liking what you're looking at. It even helps us more if you can say, here's something better. I don't like this, and here's something better. If you could do that on the 22nd, that would be fantastic. I'd love to have you back to talk about whatever you guys think is better than that which you're protesting is. Eric, thank you. Eric Odom, Executive Director.
Thanks, Don.
Thank you, Eric. American Liberty Alliance.